Okay, thank you for being here. To get started, can you say your name, your pronouns, and a little bit about yourself?
Yes, my name is Ieesha Johnson, and my pronouns are is she, her, and hers. I am the director of community outreach for Infinite Legacy and our founder of the Decision Project, which is a grassroots campaign, which was founded by Infinite Legacy back in 2016. I am from California. I moved to the Baltimore area back in 2010. I love to cook, I love to run, and I love what I do.
Thank you so much for sharing. As an in-house coordinator in the past for one of the largest trauma centers in Los Angeles, to now being director of community outreach for Infinite Legacy in Maryland, you've no doubt had an extensive and impactful role in organ donation. Can you share what encouraged you to be involved and dedicate your career to it?
Um, yes, my story is a little bit interesting, actually. My best friend worked for the organ procurement organization back in California right after college. And she had invited me to an event and said, we're having this event at work. I just started. I don't want to go by myself. They're offering, they're going to have lunch. So, of course, I'm like, sure, I'll go with you. And when we got to the event, it was actually their ceremony of remembrance, where you honor the donor families from the organization, where families get together and just remember their loved ones who were organ donors. And I was so moved by the concept of organ donation. I never talked about it, never thought about it. And I immediately signed up to be an organ donor, but I also wanted to work for that organization. 6 years later, they had an opening and I started working in their hospital services department. And that's my story. And I'm still here. 16 years later, I will be celebrating my 16 years in 2 weeks.
Wow, it's a long time. And as a long-term advocate, what positions of leadership have you held and how do they shape your current approach to outreach?
My former title was community outreach manager, and almost 2 years I've been our director of community outreach. I feel myself more of a servant leader. I sometimes my boss likes to say I'm too much in the weeds of our day to day, but I started working in community outreach right after college, and my heart will always be working with underserved and marginalized communities and talking to people in their element. And so as a leader, I like to model what I would like my team to do. So I would never ask them to do something that I wouldn't do myself. And I know that can be a pain sometimes because if I can work to 10 o'clock at night on the weekend at a table, I expect my team to do the same. But I'm also someone that likes to showcase my leadership in a way where my team can grow as well.
That's beautiful to hear. Thank you. And similarly to what you mentioned about working with different communities, what kind of discrepancies have you seen exist between different socioeconomic groups that you feel deserve more attention and more work towards creating equity in the realm of organ donation?
Right now, well, we have over 60% of those waiting for organ transplant are people of color. So the majority of people on the wait list are Black and Brown people. And the way that we try to work around that is to be in the communities where they are. So my team, we focus in community education in a whole, but more oftentimes than the others, we try to work in our marginalized and underserved populations. And that could be in our Black community, our Hispanic community, Asian American. It could be a rural community. It's somewhere where our education is not at the forefront, or our donor designation status, meaning those who register to be an organ donor, may be low. So we focus on data. So if I'm looking at a community where a lot of people are saying no to organ donation, we're going to find out the why, and the only way to find out the why is embedding ourselves in the community and then asking the right questions, and then also meeting people where they are. So if I'm in a community talking about organ donation, but the same community is having hard access to food and healthy eating, and they're in a food desert or a food swamp, then my team, we're going to pivot and we're going to work around and see how we can help the community by giving back and then talking about organ donation as a secondary conversation, if
Mm.
that makes sense.
Yes, absolutely. There are a lot of collaborative components to health that you seem to be addressing. Are there common threads as to why people have said no, and in which ways you address those answers?
Yeah, the most common myth that we hear a lot in our communities is that if someone was to know that they're an organ donor, that the hospital staff or the emergency team won't do anything to save their life, and they're just going to go ahead and make them an organ donor. That is not true. Organ donation does not happen um, by the hospital team. The organ donation happens after all life-saving measures have been met, and if the patient has to meet criteria. And the number that we use is about 5% of people who actually would die may be eligible to be an organ donor. That doesn't mean you actually will be an organ donor. So the pool is very small, and nurses and doctors are the first thing they're trying to do is to try to save your life. And I always bring it back to a conversation. Well, when you went to the hospital, did they access to see your license? Did they try to find if you're an organ donor? They don't have access to that, and they're there to save your life and make sure all life-saving measures are being met. Another myth that we hear a lot is that I'm already sick, that I can't be an organ donor. That's not true. We always say that the biggest gift is just saying yes. You're an automatic hero by saying yes to donation, and just allow the medical teams to figure out if you're suitable to be an organ donor. People believe that they may not be able to afford organ donation, and that's also a myth. Families do not pay for organ donation. So there are a lot of myths in my team. Our job is to listen, never to I'm sorry, never to just say that their myth doesn't matter or the reason doesn't matter. I should say that, and it's just to listen and then actually have a fact with that. And I think my team does a great job by dispelling those myths.
Thank you for all that clarity. And so ODAC this recent month participated in May's Youth Advocacy Month. So what type of advice would you give to young people who want to have that type of large scale impact on their surrounding communities?
I think what I would say to young people, I feel our younger generation are, they're more eager to want to help and, save the world. And so the best thing that we would do is just to always let them know that they have a choice, that if their state, because every state is different. So, like in the state of Maryland, for instance, to sign up to be an organ donor, you have to be 15 years old and 9 months. So they wouldn't get the question until their age. But we always make sure that we show them images or people or share stories of teens that are just like them, who either are waiting for a life-saving organ, who were organ donor, and we keep it 100% real. Like we do a lot of simulations around driving and what could happen if you were in a car accident, and like just bringing it back to them and how they interact. We work with driver license schools, we do high school education, but it's about empowering them at a time of their life where they may feel like they don't have all the decisions. So we give them that option when they're able to say yes, but also do understand that until they're 18, their loved one, their parents still has the right to authorize donation or not. But it's just giving them back the decision and empower them as as youth to say, hopefully say yes to donation.
And are there any stories from the people and the groups that you've worked with that especially come to mind and that you'd like to share?
I think Olivia, she is a heart recipient from Maryland. I believe she was between the ages of 7 or 11, and that she got her transplant. And to this day, she has now graduated. She goes back to her high school and shares her story. And I like those stories because we hear about stories like the Selena Gomez and people who are celebrities, but we always like to bring it back to our hometown. We always like to say, this is your neighbor, and they received a transplant, or this is your neighbor and they said yes to donation. There's another story that our team loves to share, and his name is Jordan Taylor Brown. He was unfortunately killed by a tragic incident in Baltimore City, and he was able to save over 7 people lives for organ donation. And their family actually started a foundation in Baltimore to help stop the gun violence in Baltimore City in his name. And he was only 21. And the fact that when you're talking about donation in communities, you want to see people that look like you. And so that is something that we like to share a lot of.
Thank you for sharing. And um, would you like to share about the name of the organization that his parents have formed and give any other shout out to groups or support groups or organizations that provide for recipients or donors that mean a lot to you?
Donate Life Maryland is the organization that holds our registry. So anyone can sign up in the state of Maryland to be an organ donor. And that website is www.donatelifemaryland.org. And then also Infinite Legacy is our new name. And we're proud to talk about how that new name became. We were formerly the Living Legacy Foundation of Maryland, and we merged in January with our sister organization, which was Washington Regional Transplant Community. And now that we're serving over close to 10 million people, we want to continue that legacy, and that lives on in our organizations or in our community. We also work closely with SODA, and that's the Student Organ Donation Advocacy Group. We work closely with VTA, which is the Veterans Transplant Association. And then we also work closely with another group, TRIO, which is the Transplant Recipient International Organization. I'm getting thumbs up from my team. A lot of acronyms, but we partner with CASA, we partner with the NAACP, we partner with the Latino Providers Network. We're building relationships with the Filipino Nurses Association. So there's always opportunities for us to continue our partnership to share the awareness of organ, eye, and tissue donation.
I really appreciate hearing you today and for sharing everything that you did. And I want to give you just a small moment to, say anything if you have last remarks. Yeah.
I just want to say that there are over 103,000 people waiting for a life-saving organ. And the more that we do in our communities to educate about the importance of organ, eye, and tissue donation, the more that we're able to get people to sign up to be organ donors. The more we're talking to our communities and people like you who want to hear our stories and about why it's so important to say yes and be a hero, to give life to someone else is really, really important. And at the end of the day, the decision is yours. And we want to make sure that you share that decision, you feel empowered by it, and that you live a long and healthy life.
Thank you very much for that. We're very grateful for all of the incredible work you do.